assistance. We hope that Japan and the United Kingdom would remain seized with the issue and play a meaningful role on the question of Rohingya repatriation to their homeland. Ladies and gentlemen, I take this opportunity to further congratulate the Ambassador of Japan and the High Commissioner of the United Kingdom for their kind efforts in arranging this much needed vaccines to the people of Bangladesh. Finally, I would like to thank the respective governments for their kind gifts. Thank you, ladies and gentlemen.
Thank you, sir. Thank you for your kind remarks. Now I would like to request His Excellency Sheldon Yett, country representative of UNICEF to Bangladesh.
Thank you very much. I want to say thank you to the government of Bangladesh for their leadership in ensuring that the entire population is vaccinated and is vaccinated as efficiently and rapidly as it has been. And I want to say thank you to the government of the United Kingdom and the government of Japan for their partnership and their generosity and their ability to bring these vaccines here. As UNICEF, we are a proud member of COVAX. We are the part of COVAX that's responsible for bringing in the vaccines, some 60 million vaccines to date. And both the government of Japan, the government of the UK have been core and essential members, have helped not just ensure that the population of Bangladesh is vaccinated, but populations all around the world. And as UNICEF, and I know I speak for my colleagues from the World Health Organization, we are very, very proud and eager to continue working with our partners and to continue to work under the leadership of the government of Bangladesh and its health professionals to ensure that every citizen in this country gets vaccinated and gets vaccinated as quickly as possible. Thank you very much.
Thank you, Excellency, for your brief remarks. Now, I take the privilege to request His Excellency Robert Chatterton Dixon, British High Commissioner to Bangladesh. Excellency.
Well, thank you very much. I'd just like to echo the thanks of Sheldon to the government of Bangladesh for its extraordinary leadership in vaccination. I've just got three things I'd like to say, really. The first is I was at the airport on Monday night to see the consignment arrive, and it is very satisfying how big a box, 4 million doses of what we like to call the Oxford AstraZeneca vaccine is when it arrives, and I'm delighted that we've been able to make this very tangible contribution to the vaccination program in Bangladesh. Because I think the point is that Bangladesh has been an exemplar on the effectiveness of vaccination as a tool of social development for many years, and what that means is that there is a very well developed infrastructure to support the delivery of vaccination in Bangladesh, and it's wonderful to feel that the doses that we are supplying, we know will go into a robust and well-developed mechanism to get them very quickly from the airport into the arms of the citizens of Bangladesh where they should be. So that is a wonderful thing. The second thing I wanted to say is just how I see this as an absolutely essential extra contribution to what is already a very powerful organic relationship between the UK and Bangladesh. As has been mentioned, it exists in all sorts of dimensions, whether it's development, trade, defence, security, and of course the very strong people-to-people connections that are provided by the 600,000 plus British Bangladeshis, many of whom have made an extraordinary contribution as health professionals to the health response to COVID in the UK. And it's wonderful that we're able to repay that through the donation of the vaccines that we're celebrating today. And finally, I'd just like to say, here we are on the 50th anniversary, really looking forward personally to participating and being present at the wonderful 50th anniversary celebrations tomorrow. And the word that we've been using for the UK element of that over the last year is this Brit-Bangla Bondon, this very strong tie between our two countries. And I'm delighted on the eve of liberation to be here at the Padma State Guest House celebrating the arrival of a very tangible new element to Brit-Bangla Bondon. So thank you all very much, and thank you to UNICEF and our partners and to the government for this exceptional partnership. Thank you.
Thank you, Excellency. Thank you for your very kind words. Now I have the unique pleasure to invite His Excellency Ito Naoki, Ambassador of Japan to Bangladesh, to come to the dais to say his remarks.
Thank you very much. Honorable Minister of Health, Mr. Malek, Senior Secretary of Health, Secretary Mofa, Country Representative UNICEF, and British High Commissioner. Distinguished participants, Assalamu alaikum. It gives me great pleasure to present here for the handing over ceremony of AstraZeneca vaccines from Japan to Bangladesh. It is particularly gratifying to do this ceremony together with British High Commissioner, and I think it's so significant, as Secretary said, that we are in the final week of Mujib Borsho, and today we are on the eve of celebration of 50th Victory Day tomorrow. So I think it's so meaningful that we all together get here and do this handover ceremony. I must thank UNICEF for wonderful cooperation, and I also would like to thank Minister of Health for their wonderful cooperation and collaboration. So I'm delighted that Japan delivered 788,200 doses of the AstraZeneca vaccines to Bangladesh through the COVAX facilities yesterday. We plan to provide 704,010 doses next week, which will add up to approximately 1.5 million doses. In July and August, the government of Japan provided over 3 million doses of AstraZeneca vaccines to meet urgent needs of the Bangladesh people who had been waiting for the second shot of AstraZeneca vaccine then. So I'm so satisfied that the way the AstraZeneca vaccines provided by Japan were effectively utilized for the purpose of inoculation for those people. However, there are still many people who require vaccination in Bangladesh. I know that Honorable Minister aims at reaching a very high number of inoculation. So it is also unpredictable how the Omicron variant will develop. Thus, Japan decided to provide another 1.5 million vaccines to Bangladesh in light of our friendly relationship between our two countries. In total, 4.5 million will have been sent from the people of Japan to Bangladesh friends. This is purely for the sake of the health of the Bangladesh people. We hope this vaccine support will contribute to the Bangladesh government's further efforts to prevent and contain the spread of COVID-19. I hope the gift from the Japanese people will help ensure equitable and comprehensive access to vaccines in Bangladesh. Bangladesh and Japan will also celebrate the 50th anniversary of establishing diplomatic relations on February the 10th next year. We are time-tested friends, and our partnership has become even stronger under the pandemic. I would like to reiterate that Japan will stand by Bangladesh in the fight against COVID-19 and continue collaborating closely with Bangladesh in its development journey. Thank you very much. Shobayake onek dhonnobad.
Thank you, Excellency. Now it is the time for, vaccine handover. Now, I would like to request His Excellency, the Ambassador, the High Commissioner, and also the country representative of UNICEF to Bangladesh to hand over vaccines to the Honorable Minister. And I would like to request Senior Secretary Sir and Secretary Sir to join the Honorable Minister to receive the vaccine gift. One by one.
আমার সামনে যায় না কারো দাঁড়ানোর দরকার নেই
Now the Thank you, Excellency. Thank you. Now I have the pleasure to request Senior Secretary Lokman Sir to say a few words on the occasion, and after that Honorable Minister will finally speak. Senior Secretary Sir.
Assalamu alaikum and very good afternoon. chief guest of this ceremony, of this receiving ceremony, Honorable Minister, Ministry of Health and Family Welfare, Mr. Zahid Malik, His Excellency Ambassador of Japan to Bangladesh, His Excellency Ambassador High Commissioner of UK of Bangladesh, Chief of UNICEF, Acting Secretary of Ministry of Foreign Affairs, distinguished guests, ladies and gentlemen, friends of electronic media. First of all, I would like to respect Father of the Nation, Father of the Nation who sacrificed a lot for us to achieve our independence. I also respect our freedom fighter, those who sacrificed during the liberation war. I am very delighted to the President here for receiving the vaccine donation ceremony, because our long-time partner friend of Japan and United Kingdom, we have a passing very good time, because you know the pandemic COVID gave a very good lesson that nobody can save alone without the help of the others. So world became a global village, and everybody help for everyone. This is we are very much happy, because by this time when we are in passing crucial moment for the vaccine crisis, that Japan donated about 36 lakh vaccine, and yesterday they also donated another 8, total of 44 lakh vaccine. Yesterday our UK, one of the best friends, they also donated 4 billion vaccines. We have received different friend country donation and also COVAX. Not only that, we purchased near 21 crore and also donate near about 11 crore. Total, by this time we have purchased and committed total number 31. By this time we have vaccinated near about 111 million people. We hope that within December 50% people will be vaccinated. So I would like to thank Ambassador of Japan and people of Japan and Ambassador of High Commissioner of UK and people of UK, because they donate the vaccine for us. It will be helpful to vaccinate our people also. Japan is a very good friend from the very beginning of our journey. Most of the mega project, they are partner, especially Matarbari project, one of the biggest project that was executed with the help of the Japan also. Monorail project also in different mega project Japan help us. Also, UK also help our different humanitarian ground also. Along by this time, study they donate 4 billion vaccine. It will be help us to vaccinate our people. After all, I would like to thank on behalf of Bangladesh on the Ministry of Health and Family Welfare for this donation. Thank you very much. Salam.
Thank you, respected sir, for your very brief remarks. Now I have the pleasure to request Honorable Minister sir to put his remarks.
Bismillahirrahmanirrahim. In this auspicious occasion of receiving about 4 million AstraZeneca vaccine as donation from our friendly country, the United Kingdom, and being handed over by His Excellency Mr. Robert Chatterton-Dixon, British High Commissioner to Bangladesh. We have also with us our His Excellency Mr. Naoki ITO, Ambassador of the Government of Bangladesh, Government of Japan to Bangladesh. We have with us also His Excellency Sheldon Yett, Country Representative, UNICEF, and our Senior Secretary from Health, Mr. Lukman Hussain Mia, and friends and the personalities from media So a very good afternoon and Assalamu alaikum. It is a pleasure for me to receive vaccines from both of our most trusted friendly countries, UK and Japan. They have been helping us since the inception of Bangladesh. People of Bangladesh are always grateful to the people of both the countries and the government. Till now, we have been working together for the containment of coronavirus and also working together to improve the lot of Bangladeshi people. They are our most trusted development partners as well. You know that under the leadership of our Prime Minister Sheikh Hasina, Bangladesh has been making improvements in all sectors, not only in health, in providing electricity to all the people of the country, in food self-sufficiency, in big infrastructure where both Japan and UK is helping us in developing those big infrastructures, and also helping in our health sector. You know, Bangladesh has been able to contain coronavirus quite effectively till now. Here the total death is 28,000, and which is compared to the size of the population is I think quite less compared to many countries. Presently the death has come down to single digit, 3, 4, 5 persons per day, and infection rate is just little over 1%. So this we like to keep as it is, and this has been possible due to the early rollout of vaccines, in that our friendly countries like Japan, the government of Japan and people of Japan has donated till now directly and through COVAX facility about 4.5 million vaccines, and UK also today we are receiving about 4 million vaccines. Both the vaccines, the type is AstraZeneca. Bangladesh has a good experience in vaccinating its people. Till now we have been able to give 11 million doses of vaccine to our people, single and double dose. In the single dose it is around 68 million doses, and double doses is about 44 million doses. Total vaccinated population is 48.8% of the targeted population. That is, our targeted population is about 120 million plus, and double dose is about 32% of the targeted population, which I think is quite impressive, and we want to attain the WHO mandate of 50% by December. And by April, we hope that April, May, if the vaccines are available and things are okay, then we should be able to reach our total targeted population. In our stock, we have got 46 million doses now, and we purchased also about 220 million doses till today. We received 160 million doses, and you know that we have got a high capacity to give vaccines to our people, which we have already shown that about 8 million in one day we could give a vaccine. So that is quite a huge number. In this month of our liberation and victory, we plan to give over 10 million doses within this month, another 10 million doses within this month. So, in this month of victory, we are here to celebrate the Victory Day, which is tomorrow. And I recall with gratitude and I pay my homage to our father of the nation, Bangabandhu Sheikh Mujibur Rahman, who led the liberation of Bangladesh, and also pay homage to our martyrs who laid down their lives in liberating the Bangladesh, about 3 million of them. And I also recall during those days, even the BBC has been playing a good role in our liberation time. So at that time I was a school going boy, so I could remember that BBC played a very vital role in telling the real stories taking place in the then East Pakistan, now the Free Bangladesh. I also express my good wishes to the people of Japan, to the people of UK for their support, continuous support, and they will, I hope that they will continue their support in days to come to mitigate the problems that we face in Bangladesh. And COVID has proven that this is a global village. No one will be safe until everyone is safe. No one can be left behind. So we have to vaccinate the entire world in order to get the world free from COVID in whatever mutation it comes. Now the Omicron is here. In Bangladesh, we have got 3 cases in Bangladesh. And they are under in the quarantine, and they are keeping good health, they are, I think they will be soon recover. They will soon recover from this Omicron infection, and we hope that there will be no spread of Omicron in Bangladesh, provided we follow the health guidelines. That is, we get vaccinated, we wear masks and maintain social distance. You know that in Europe and also in UK, the Omicron is also spreading there. So we have to be very careful about Bangladesh because it is a densely populated country. So Omicron is a virus which spreads very fast. It may be mild, but spreading is very fast. And WHO DG last night said that if it could infect many people, then it will require also the many beds in the hospital, because there will be many patients in the hospital. তো সাংবাদিক ভাইরা, আপনাদেরকে আন্তরিকভাবে ধন্যবাদ জানাই, আপনারা এটা কভার করছেন। আজকে আমরা 40 লক্ষ ভ্যাকসিন আমরা ইউকে থেকে পেলাম, জাপান থেকেও আমরা প্রায় এ পর্যন্ত 45 লক্ষ ভ্যাকসিন আমরা পেয়েছি, এবং আমরা এই অ্যাস্ট্রাজেনিকা ভ্যাকসিনগুলো দিয়ে যাচ্ছি। আমরা 11 কোটি ভ্যাকসিন ফার্স্ট ডোজ, টোটাল আমরা 11 কোটি ভ্যাকসিন দিয়েছি, এবং 7.5 কোটি ফার্স্ট ডোজ, এবং সেকেন্ড ডোজ আমরা দিয়েছি হলো প্রায় 4.5 কোটি। অর্থাৎ আমাদের টার্গেট পপুলেশনের প্রায় 48% ফার্স্ট ডোজ পেয়েছে, এবং 32% ডাবল ডোজ পেয়েছে টার্গেটেড পপুলেশনের। এবং ওমিক্রনের বিষয়েও আমি বলেছি যে যারা আক্রান্ত হয়েছে তারা ভালো হয়েছে, এবং এখন তাদেরকে শিফট করে আমরা হাসপাতালে রেখেছি, এবং তারা সেরে উঠছে। আপনাদের মাধ্যমে বলতে চাচ্ছি যে ওমিক্রনকে কন্ট্রোলে রাখতে হলে আমাদের সকলকে মাস্ক পরতে হবে, সামাজিক দূরত্ব বজায় রাখতে হবে, এবং আমাদের ভ্যাকসিনেট হতে হবে। এবং বেপরোয়াভাবে আমাদের চললে দেশের ক্ষতি হবে, এবং আমাদের যে ভালো অবস্থায় আছি সেই ভালো অবস্থা আমাদেরকে সকলকে রাখতে হবে। Once more, I thank the High Commissioner of United Kingdom and the Ambassador of Japan and the people of both the countries for their generous contribution to the people of Bangladesh. This will cement the friendship between both the countries, and that will be cemented, strengthened in days to come. Thank you. Jai Bangla, Jai Bangabandhu. Assalamu alaikum.
Thank you, sir, Honorable Minister, for your very detailed speech and also guidelines for us. Now, this is the end of the program, and from the Podda State Guest House and from the Minister of Foreign Affairs, we thank you all for your kind attention. Thank you all.